Many clinics track patient outcomes, but they aren't using that data to improve them. We built software to solve this. It uses your historic clinic data to generate predictive coefficients, calculating a session by session probability of treatment success for every new patient. This is the Predictive Suite. It's almost entirely modular, can run phase 1, phase 2, or phase 2 and 3. Starting with phase 1, the Predictive Blueprint. It's a 3-step process. Ingest your historic data, configure the core models and definitions of success, and map out your session predictors. The engine takes over, running the statistics to output a complete zip file with your new predictive coefficients and key metrics. That leads to phase 2, the trajectory tracker, where those coefficients go to work. The system is agnostic. You can use a custom model we just built or bring in your own pre-trained model. An important feature here is Autopilot. Once enabled, Autopilot watches your data folder. Whenever new data drops in, it automatically calculates the probability of success for every active patient and outputs a fresh, updated zip file. However, raw data can be hard to interpret. That's why we built phase 3, the Clinic Director Dashboard. When Autopilot runs, it updates this dashboard automatically. Clinic directors get a bird's eye view of their caseload to instantly see who's off track and can click into any patient for a deep dive to map out their trajectory, momentum, and compare them against clinic averages. Like every other phase, this phase is highly flexible as well. You can toggle dynamic color coding to flag patients who are off track or just doing average, and you have complete control to specify exactly what those performance thresholds should be for your clinic. However, phase 3 is entirely optional. Because the suite's modular, if you have your own internal system, you can just take the automated output from phase 2 and visualize it yourself there. Another important part of this suite is that the engine runs entirely locally, 100% on your machine. So data never touches the cloud, meaning zero HIPAA risks. So if you're ready to stop guessing and start predicting, click Request a Feasibility Review down below, and let's see what your data can do.